And our first doctor that will address the rally is the former Chief of Staff. 38 years of service to the residents of San Leandro at San Leandro Hospital. Please welcome Dr. Miles Adler.
Obviously, a lot of the things that I'm going to say have already been said because we're all in this together. San Leandro Hospital has been here since 1960, almost 50 years, and we have had an acute care facility and an emergency room during all of that time. We're here really because of the community. We're here because as physicians we want to serve the community, we want to take care of our patients. We understand the limitations of payer mix, of people who can't afford private health care insurance. We're all here despite that. Many of us standing in the audience have been here for 10, 15, 20, 30, 35 years. We understand that. 40 years, Dan. Don't want to slight you. Clearly, we understand what has to happen. It's been spoken that the capacity of the hospital is going to drop from 275 down to 130. When the new hospital is built in 2013 or 2012, whenever it's going to be, the number of beds will be 130. Before you get excited about 130, understand that some of those beds are going to be OBGYN, some of those beds are going to be for the trauma patients, some of those beds are going to be pediatrics, some of those beds are going to be for the neuroscience center. So the actual number of medical surgical beds is going to be very small. If this hospital closed today, this very day, and all of the patients that are physically at San Leandro Hospital had to move to Eden because we have all medical surgical beds, there would not be enough room for them. There would be 20 people who would be out on the street without bed capacity. We also have to mention that Eden plans to close mental health services. This is a big deal. There is no community mental health service anywhere. John George is not a private community mental health facility. Where are these people going to go? Sutter plans to close this hospital and give it or sell it, probably give it, to the county. The county wants to open San Leandro Hospital as an acute rehab run by the county. They will downsize it to 40 or 50 beds. They will have an urgent care center, which may be open 24 hours, likely will start to be open 12 hours a day for urgent care. Please understand this is a county facility like Highland, and I ask if all of our patients are going to feel as comfortable coming to this facility for urgent care as they feel to come to the emergency room, which is well staffed and does a terrific job in the community now. It was mentioned about emergencies. The whole reason that the county wants to close Fairmont and move the Fairmont rehab here is because of earthquake safety. That's one of the reasons that Eden wants to rebuild. If there is an earthquake, where are the people who live on this side of the 580 freeway? Where are they going to go? The 580 freeway is the Hayward Fault line. If there is an earthquake on the Hayward Fault, the people living west of the freeway are not going to be able to get to any medical facility. It's all going to be blocked. What's going to happen in case of a disaster, an epidemic? We saw a little taste of that in Mexico City with swine flu. Where are these people going to go? Moreover, when you have a hospital like Eden, which already has a wait of 3 to 5 hours, and you put an additional 1,000 patients a month or more there, your wait is going to be 6 to 10 hours. Eden will close their emergency room for ambulances because they will not have any CCU or ICU beds. So we will be on what is called divert, which means that if you have a heart attack outside our office, you can't get to Eden. It's 5 o'clock in the afternoon. I think we'll take you down to St. Rose. We'll take the 238 down to 880 on Friday. Good luck. It's 8 o'clock in the morning, and we're not going to go to St. Rose. We're going to go up the 580 freeway to Summit. Good luck. Alameda Hospital, nice facility, but you can't get there from here, really. So we have to understand that the county has a community responsibility to look out for the health and welfare and safety of its inhabitants. We serve a community of 125 to 150,000 people with Oakland south of Oak Knoll, this community, San Lorenzo, some Hayward. We can't be without an emergency room. We can't be without a hospital. We need to instill on the major players, Sutter Health, the county, and the Eden Township District, that we must keep this hospital open. In the next day or two, there will be an announcement that there is a vendor from Southern California who is interested in buying this hospital and keeping it open as an acute care facility with an emergency room. However, we've got to get Sutter and the county and the Eden District to approve that. If they don't, they will close this hospital, and it does not look in this economy and for any time in the future that San Leandro will ever have an acute care facility, which is really a shame for all of us. Thanks.